All right, so we're doing an abdominal assessment. I've washed my hands, checked the room for safety and privacy. So we're gonna go ahead and get started. First, we're just doing an inspection. Color is normal for the patient's race. Temperature is warm. Skin is dry and smooth. I don't see any evidence of bruising, lesions, or nevi. She does have a scar over here on the left. It's about 2.5 inches. It's consistent with a neurostimulator placed about 7 or 8 years ago. Okay. Next, we're just going to move on to inspecting for symmetry. So I'm seeing symmetrical. I don't see any pulsations or protrusions, anything noted of a hernia or an abdominal aortic aneurysm, slightly rounded belly. So now we're just going to move on to auscultating the arteries. So we'll start with abdominal aorta and then move on to renal arteries, iliac arteries, and the femoral arteries. Using the bell of my stethoscope.
Breathe in. Oh.
Just gonna pull these a little bit so you can. Go.
I'm looking at this to find what
All right, so no bruise detected in any of the arteries. Now I'm going to auscultate all 4 quadrants for bowel sounds. Normal active bowel sounds noted in all 4 quadrants. Now we're going to move on to some light palpation. And while I'm doing this, I'm checking the patient's face for grimacing, any tenderness when I'm pressing. Is there any tenderness when I'm pressing? Okay, good. Now we're going to move on to a deeper palpation. Just checking for masses. Good. I didn't feel any masses or any abnormalities. So now we're just going to check for the liver border. I'm going to be breathing in, out, in, out. Okay. You can breathe normally. Like the liver border here. We're coming from the 4th. A little over 3 inches, so about 7.5 centimeters. Next, we're going to palpate for the spleen at the left costal margin. So I'm starting over here, iliac, just palpating up. And I shouldn't be able to palpate the spleen. Okay. All right, so I'm not able to palpate the spleen. So next we're going to just move on to percussion in all 4 quadrants, and we're looking for tympani, all right. So no dullness detected in any of the quadrants, which would be suggestive of a mass. Now we're just gonna percuss for the spleen at Traub's point. I'm looking for dullness. Somebody's hungry. Okay. So next we're just going to move on to some techniques that will help us with diagnosis of gallbladder inflammation or appendicitis. So the first one we're going to do is Murphy's sign. So what I'm going to do is come to the right upper quadrant under the subcostal margin. I'm going to have you breathe all the way in. Okay, any pain? All right, go ahead and breathe out. Next, we're going to locate McBurney's point. So from the umbilicus to the iliac crest, about 2/3 of the way in, we're pressing and releasing. Any pain with that? Okay, pain would be suggestive of an appendicitis. So next we're going to move on to Soa's technique, which is just having the patient raise their right leg. I'm going to push against their thigh. They're going to give me some resistance and push up. Any pain with that? Good. Pain again would be suggestive of a possible appendicitis. Arbitrator's technique is next. So what we're doing is having the patient raise their leg again, bending at the hip. Okay, and we're going to apply pressure this way. Any pain with that? Okay, good. That again would be suggestive of possible appendicitis. And then our last one is Rovsing sign, which is palpating in the left lower quadrant across from the right lower quadrant where the appendix would be located. So we're going to palpate, release. Any pain with that? Okay, good. So a positive sign would be applying pressure, releasing, and radiating pain coming over to where the appendix is located. All right, and that's a abdominal assessment. Thank you.